As enrollee satisfaction in the implementation of the state health insurance scheme continues to top the agenda, the Delta State Contributory Health Commission has trained primary healthcare workers across the Delta South Senatorial District. The training, which drew primary healthcare workers from different communities across the Delta South Senatorial District, held in Warri. The Director General and Chief Executive Officer of the Commission, Dr. Isaac Akpoveta, said the training had been intensive and practical to ensure the participants were equipped with the requisite knowledge to implement the new policy guidelines of the Commission. Dr. Akpoveta said Delta State had maintained its #1 position in the country in terms of healthcare, but the Commission was not resting on its oars, adding that all efforts were being channeled to close all gaps capable of disrupting the vision behind the state health insurance scheme. He said Governor Sheriff Oborevwori, in line with his more agenda policy thrust, had empowered the Commission to carry out its mandate, which is aimed at providing affordable and quality healthcare, as well as reducing out-of-pocket medical expenses of residents of the state. The DG expressed optimism that with the training, participants now had the knowledge and skills to provide improved services to enrollees in their various facilities.
I told them that primary health care is the bedrock of universal health coverage. Without the spread of primary health care across the nook and corners of Delta State, we cannot achieve universal health coverage. So they are quite important. They made that clear to all the OICs, and therefore they are glad to adopt it. And I'm sure they will continue to adopt and accept the principle of health insurance, because they are going to also make money from the primary health care centers. They will treat lives and they will ensure the safety of people in terms of health. And so they are glad. I will continue to encourage them and encourage Deltans to register into the scheme in the primary health care centers. There are a lot of shortcomings in primary health care centers in terms of resources, human resource, medical equipment, and so forth. Security issues. I'm going to take this up with the system and see how we can ameliorate this level of discomfort on the performance of the primary health care system as a result of shortage of resources that we have to make the principle. You can see I'm adjusting the policies to fit into the old way of doing. We cannot do it. It's not a straight jacket thing. And adapt to the situation we have. And I'm sure between now and the next 6 months, a lot of changes will happen in the healthcare system.
Participants thanked the Director General for educating them on the concept of health insurance and their role in helping citizens benefit from government programs, promising to put the knowledge gained into good use.
On behalf of the all IGAs in the Delta South Senatorial District, the communities, the wards, and all the OICs and workers, we want to appreciate first the Almighty God that has given us the ability to be here today. And secondly, and most importantly too, we want to appreciate His Excellency, our Governor, Elder Sheriff Oborevwori, for this laudable project of the State Contributory Health Commission that is reaching out to the less privileged in the society. It has brought a lot of smiles and hope to the less privileged. And to our amiable Honorable Commissioner for Health, Dr. Joseph Ono-Jaime, who is the father of health in Delta State, for supporting the more agenda of our executive governor. And to our father in the commission, the royal physician, Honorable Dr. Isaac Akpoveta, for standing strong and bringing life to the Delta State Contributing Health Commission, we want to say a big thank you, sir. Because on this lies the head that wears the crown. Paying those people who are doing excellently well according to their performance. You have been appreciating hard work, and we promise as OICs in charge of the various health facilities to do our best to key into the more agenda of the governor and the commission's policy to see that our mothers who are pregnant are given quality maternity care and our children under 5 are treated. By this, eradicate maternal and child death from Delta State.
Primary healthcare workers in the Delta North and Central Senatorial districts of the state had earlier been trained by the Commission. Eunice Emeazia reporting.